Sure. Well, healthcare has always been rooted in technology and innovation, whether it's, laboratory testing, medications, diagnostic testing. So, I mean, from developing an electrocardiogram to discovering a new vaccine to discovering new imaging technology. So we've always had technology and innovation. What's changed a little bit, as Anil mentioned, with the internet and the ability to reach more people and to reach people outside of the healthcare setting, that's where the technology that we're focused on really has a lot of promise. It's really designed to promote, using a public health approach, promote positive behavior, but it is only a tool. And it's only a tool that works if people actually do it. It's not a one size fits all. There's a lot of different ways to promote that behavior. One thing that's very exciting to us is technology has the ability to improve access. There are a lot of people in the US and around the world that just don't have access to the same type of healthcare services the people who may live in the cities do. So you can improve access. You can do simple things like reminders. It can just simply be, hey, don't forget to take your medication. There are ways to track data. That's also very, very encouraging. So whether it's your physical activity with a physical activity tracker, whether it's tracking blood pressure with a connected device. So again, there's a way to not just rely on, say, the blood pressure that was taken in the doctor's office, once a year, or to have to rely on the individual's memory. You can actually track things in real time. And the idea then is to be able to get that feedback back to their healthcare professional. Another very important aspect of prevention is education. Sometimes we minimize the role of education, but it really is the roots. It's the knowledge. If you don't have the knowledge, if you don't understand, then you're not going to be able to do any of the other things. So it's a way to educate. And again, there's different types of technologies, whether it's listening to a webinar like this, collecting a message on your smartphone. There's different ways to do it, even a message that's coming from your watch or your activity tracker. And then finally, it's a way to connect with people, again, outside of that local community. It's a way for healthcare professionals to connect, and it's even a way for other patients to connect. There's a lot of relatively rare conditions, and so you might not have very many people with the same type of condition in your local community. You can connect. I know there are challenges of social media, but the reality is, if done well, that connected piece of it is a huge part of helping people change and maintain those behaviors.
Those are all fascinating angles. So I'm going to ask Sri at this point of time. Sri, you have spent a long time in leading various technological innovations in other fields, and now you are in healthcare. And how do you see this change happening in healthcare, and especially focusing on the preventative side?
Yeah, Santosh. Yeah. So in addition to what Pat just talked about, right? I think we are all aware of the progression in technology in anything. So if you take telephones or airlines, right? Initially, they're available to a small number of people when you have to go to special places. Same way, if we took like some monitoring technologies, you had to be in a hospital, inpatient, right? Now that kind of monitoring is available at home, right? Just like how we all have access to, more of us have access to phone and all that, right? Then the next big thing, what Pat and Anil touched on, medicine is meant to be very personalized, right? You go to your doctor to get a care for yourself. But public health is meant to be, from preventive perspective, is meant to be very broad oriented, right? So how can we get that scale and yet be personalized, right? That is enabled by modern day technologies, like cloud computing and machine learning, right? So what we can do is we can offer a service at scale. So we don't have to just standardize and push one piece of content. Or if you take a simple example, in India, I might have to consume that same content in multiple languages, and it's a enormous effort, and therefore you might find a lot of education only available in English, right? But if you want to really get it into the hands of the common man, then you want to you need to be able to translate it into multiple languages. That has become very easy now, right? So that's a big shift, and then from a behavior perspective, it is very important to make, when technology should really be an aid, right? It's so if I want to do something, it needs to be easy and useful to me. Otherwise, it just unnecessarily complicate things. So with the advent of wearables, right? So there are lots of wearables. Not, I mean, we know of watches, but from for different types of things, from seizure detections to BP and heart rate monitors, all of those, right? There are different variations of things that are being innovated every day. I mean, and there's talks about embedding some of these into our daily wear, right? I mean, as in clothing, so that it can keep even greater tracing and tracking of our things, so that you're not going to the doctor once a year for a preventative health checkup, right? We monitor our machines every day, right? Same way, I think we ought to be able to monitor our bodies every day and then act on it when it is needed, right? It's still a ways to go, but we can clearly see that progression happening, and it's very practical. And it's just not a matter of if, but it's a matter of when it's going to happen, right? So I think those are all things that are very attractive, and COVID is pushing these things even further because it's forcing remote care. That's forcing more innovation. So all these factors, cloud computing, machine learning, COVID forcing, more digitization across all industries. I think this is a perfect time to see these changes, be adopted.
There's different forms of prevention. So if you think of a continuum, so starting with what's called now primordial prevention, which is, so a lot of times when we think of prevention, we think of like managing a risk factor, like I'm going to prevent a heart attack. And so I'm going to do that by controlling my blood pressure. So what primordial prevention starts early in life, and it's really designed to eliminate those risk factors to begin with. So your high cholesterol, your high blood pressure, your high glucose or diabetes, also the behaviors related to that. So really early in life, forming those good habits, eating well, getting plenty of physical activity, trying to manage the stress, not necessarily eliminate stress, but manage it well. So that's called primordial. The next level up is primary prevention. So that's where we think of, okay, so again, if my goal is to prevent a heart attack or a stroke, then I do that by preventing risk factors like tobacco, high blood pressure, high cholesterol. So primary prevention is managing those risk factors. Secondary prevention is done after those risk factors occur. So now it's about treating those risk factors. So treating your blood pressure, treating your diabetes, treating your cholesterol. And then of course, some people still go on to have heart attacks and strokes, but you're trying to prevent the next one. And that's actually called tertiary prevention. So some examples going back down the line. So cardiac and stroke rehab would be examples of tertiary prevention, where you're actually managing that condition that already occurs. So you're not trying to prevent heart disease, you're trying to prevent that next heart attack from happening. Secondary prevention, maybe managing, you're being treated for your high cholesterol. Primary prevention, again, maybe using lifestyle factors. You're trying to modify your diet and get some more activity to lose a few pounds. And again, the primordial prevention is using more wide scoping preventive habits to manage your health.